Personality.
Hello everyone! Welcome to JoJo's Personality TV. I'm your host Josiah.
And I'm your co-host Jacayla.
And our mission at JoJo's Personality TV is to provide opportunities for youth and their parents to explore careers and set achievable goals. And today we are here with Dr. Greene, who is a family nurse practitioner. Hi Dr. Greene.
Hello. Thank you for having me.
You're welcome. Thank you for being on our show.
Thank you.
So, who or what inspired you to be in the medical field?
I will be honest, my parents bought me a toy medical bag at the age of 7 years old, and they really inspired me to go into the healthcare profession. I'm an only child, so they wanted me to choose a career that could basically support me in going further in life. And anything you do with healthcare, you basically have a cushion where you can do so many other things.
Was it challenging for you to be the only child?
It definitely was challenging to me. It's still challenging to me. My father's currently disabled. He has double hip replacement, and he has the traditional hip replacement, so he doesn't have bones in it. Both his bones are missing in both of his legs, and he has a metal rod there. So really just having being an only child and really just being there for my parents, still it has challenges.
How long did you have to go to college?
So I went to University of South Carolina, Columbia, for 2.5 years, but prior to that I graduated from Lower Richland High School, class of 2003. But I actually graduated early from high school, December 2002, and started college 2 weeks later after high school. And from there, I started the University of South Carolina and went there for 2.5 years and transferred to the University of South Carolina upstate in Spartanburg, South Carolina, where I got my bachelor's of science in nursing. Then I moved home and I began working at Palmetto Health Baptist Hospital and worked there as a floor nurse for about 1.5 years until I became a nurse manager. And from there I went to school, Medical University of South Carolina. I applied there in Charleston and got my first master's degree, but it was in nursing education. My goal was really to move up in the leadership realm, but when I got there, I ended up having the highest GPA of my college. So they offered for me to start for my Doctor of Nursing Practice, Family Nurse Practitioner degree. And that's how I ended up with 4 degrees. So I have a bachelor's, 2 masters. One is targeted in nursing education. The other one is a Family Nurse Practitioner and a Doctor of Nursing Practice degree from the Medical University of South Carolina. So total about 7 years of school.
Wow.
What is your most favorite part of your job?
The most favorite part of my job is really the people. Healthcare is one of those things I will tell, and I was reading your biographies, both of you all, and I will tell you, in science and in healthcare, once you learn the body doesn't change. So when you really get that anatomy and that physiology down, you can really target not only caring for your patients, but having a great rapport with your patients and talking to them about anything they want to talk about. You find yourself actually doing some mental health counseling, as well as health care. If they have a cold, if they have a sinus infection, if they have a urinary tract infection, whatever is going on, you can treat them as well as talk to them and be friendly. So I enjoy really just talking to people, all people.
What is the least favorite part of your job?
The least favorite part of my job, I would say, that's a hard question. I really enjoy what I do every day, to be honest. I would say really when I have a lot of things going on, like I do a lot of public speaking and I do a lot of extra activities, sometimes just being tired and having to get up the next day and hit the clock, and you have to be very punctual when you're in healthcare, because when you are working from a practitioner standpoint, your patients have appointments. So if you have an 8:30 appointment and you were out speaking the day before doing some community service, it can be kind of tiresome. So,
can you describe a typical work week?
Typical work week for me, I usually get in my office at 8:30 a.m. I check the temperatures on the refrigerator logs because I have vaccinations and different things in the refrigerator that I need to make sure are the correct temperature. And from there, really, I call the next patient and I assess them and see what's going on with them. And you really have to be careful when you are from a provider standpoint. A lot of patients will come in and say, well, I know I have a sinus infection and I know I need amoxicillin. You have to be that provider and you have to make sure that's what they need. You don't allow the patient to necessarily treat themselves because they could have something else going on. Like for instance, a lot of people are having flu symptoms this season. The flu is just running rampant. And so if you have someone that has flu and you're not prescribing them Tamiflu, I do a lot of prescribing them Tamiflu and different antibiotics. These people can have secondary pneumonias. These people could end up in the hospital. Something as simple as the flu can really be something serious. So the person could think that they have a sinus infection when they really have the flu.
Right. So do you have patients like that a lot that tell you what they go ahead and need?
Yes, I have patients that oftentimes they'll tell me, you know, I know I have a ear infection, or I know I have this, or I know I have that. And sometimes they are absolutely correct. I will say whenever a patient can tell you what they believe that they have, it's always a great thing because you want to listen to your patient.
So I see you brought some instruments with you today. Can you tell us some of their functions?
Sure. So when I got to Medical University of South Carolina, I had to purchase a ophthalmoscope and an otoscope. So one obviously is to look in your ears and one is to look in your eyes. You of course put this together. I'll just put it on together. And these are ear probes. So you put this on the end of the otoscope and you turn it on and you go into the ear canal. And what you're looking at when you look from the other end is you're looking at the eardrum, which is a fancy word. The proper term for it is tympanic membrane. And then this is the ophthalmoscope, and this is to look into the eyes. And then my stethoscope. Now I can't go anywhere without my stethoscope. So of course I'm gonna listen to the heart sounds, breath sounds, making sure that, like for instance, if I'm listening to the lungs, if you hear like a whistling, that's called wheezing. So you might look at that patient having asthma or COPD, ask whether they are a smoker or are they a smoker. If they do have wheezing, that may mean that, you know, the lungs are tightening up there. So you may want to prescribe something like inhaler. You ever see like before someone is about to play sports, they shake something up and they poof poof. That helps open those bronchioles, those windpipes up.
So does that like kind of give you a gist of what the whole respiratory system is doing, what's going on?
Pretty much. So if I have someone that I'm hearing abnormal breath sounds, you should hear a normal inhale and exhale. And I shouldn't be hearing all those extra noises that I was telling you about, wheezes and crackles. And actually a snoring noise is something called bronchi. So if I'm hearing any of these noises, if I don't know why, then that patient may need for me to order a chest x-ray. This is a reflex hammer. You want to go kind of right here in the middle. And the leg should have a response and kind of jump. And this is a blood pressure cuff. Definitely with the blood pressures, you'll learn when you pump it up, you're listening to the first sound that you hear and then the last sound that you hear. That's where the top number comes in at, and the bottom number sometimes when you see like 140/90. You definitely always want to get a temperature on someone, a blood pressure, and a pulse on them.
Well, we'd like to thank you so much for being on our show.
Yeah, thank you.
Thank you.
That's it, guys. Thank you for tuning in to JoJo's Personality TV. Bye.
Bye.
Don't forget to like us on Facebook, subscribe to our YouTube channel, and follow us on Twitter. Bye, guys.
Bye.
Be who you wanna be. It's your personality. Be who you wanna be. It's your personality.